People living with cancer, HIV and AIDS, dementia and non-communicable diseases may die not necessarily from that illness, but due to chronic pain. Palliative care providers feel that patients should not die due to severe pain, but deserve a decent end.
Palliative care affirms life and regards dying as a normal process. I don't think there is anybody who will not die. Once you're born, you'll have to die. But how you go is what really matters. We would love to support people to go comfortably.
Research conducted by World Health Organization in 2015 revealed that millions of people face severe pain due to various diseases resulting to death.
That more than 66 million people suffer severe health-related suffering globally. 35 million of these were at the end of life, and 5.3 million were children. 80% of these figures are in low and middle-income countries, including our East African region.
Dr Emmanuel Luyirika, who is the Executive Director of the African Palliative Care Association, says majority of these patients are unable to access morphine, the drug used in controlling pain among patients.
On the list, the essential medicines list for palliative care, there are more than 20 medicines. The reason why morphine comes up is because it's a controlled medicine. It is controlled by an international convention so that it's not abused. That's why it becomes difficult, and that's why the advocates must make sure that we have access to it, and yet it's the most important pain medicine that we need.
Though Uganda has made strides in training palliative care providers, efforts for Uganda to have a national policy on caring for the sick has fallen to deaf ears.
We started the process, we've been moving, and in 2017, we finished and we said, yes, our policy is going to be endorsed. If you ask me where it is now, I cannot explain to you. We are there struggling, looking for it. We don't know where it is.
Now, palliative care providers have petitioned the East African Legislative Assembly seeking a regional approach to address the problem.
Is to help us ensure that every health-related legislation includes palliative care for adults and children, because it's a big need.
I recommend our plea is to look at palliative care services with an extra eye and consider its resource mobilization and allocation. We are all future palliative care candidates.
Regardless that we cannot remove the condition, but we can do something to make them feel better and continue with their normal life.
What you eat determines your health, determines your survival.
I have seen some people, like in Kampala, there is what they call bedside services. I think they are doing palliative care without being trained. The recommendation should be that they should undergo specialized training in palliative care.
Palliative care is a specialized treatment and care given to patients facing severe pain. But palliative care providers say this has been ignored in many of the countries. Jingo Francis, NTV in Zanzibar.